So I think in order to do this better, one of the things that we need to do is we need to, in addition to making it individual family intervention, right? Somebody comes in and you meet with the family, you assess their unique needs and you talk to them and try to fill in holes and create some structure for a family. But we also need to go out into the community, go out into our schools and host events and talk with parents about what you can expect when your child has a mental health diagnosis, what normal development looks like. One of the things that I think is really compelling and important to talk about, for example, is this thing in the brain called pruning. Does anybody know what pruning is? Okay, so pruning happens at about 18 months and it happens again a little bit before puberty. And so I see heads nodding about pruning. Why is that an important concept to tell parents about? Anybody? So what happens in pruning? A bunch of wires get cut, right? And then you cut the wires, and what do you see from the child? You see a change in behavior, yep. You might see some regressing, right? You might see an 18-month-old after pruning, they're moody, they're tired. You might see a 12-year-old. It's the most phenomenal thing. The child wakes up one day and they can't remember any of the rules in the family. It's just sort of out of nowhere. They seem to not know anything that's going on. And I had a colleague in my private office one time come in, and he walked in and he sat down at the conference table and he sighed really big and he said, I think my teenager went over to the dark side just overnight. And what he was talking about was pruning. But he woke up one day and his kid seemed like a different person. He was a brooding, irritable teenager. And I don't think that kid's about 25, and I don't think he ever came back from that. I think he just changed one day. And so if we meet with families and we say, your kid's just gonna change one day, we can help them be prepared and we can help them manage what's going on in the home and we can keep them out of care and help them get their needs met in their home, right? And so we also need to do more outreach from the mental health community to go out into the community and say, let us know what you need from us and let us teach you something and let's all be in this together and not just wait until things fall apart. There are several things that we can do with parents that I think are helpful. And one of the things I was just talking about is education. Going through and telling people what's normal. You know, a lot of families, I think, don't know. It's even hard for professionals when you go through and you train and you learn all the little developmental stages and you try to remember, you know, Piaget's theory and what was Erickson and what are the major tasks of this time of life or whatever. But a lot of families have had none of that information. So going out with families either one at a time or en masse and saying to them, these are the stages children go through, can go a long way to giving them tools to manage problems that come up in their homes or to prevent problems from coming up in the first place, right? And so, and again, focusing on the cognitive changes and the emotional changes that come with that. And so saying to somebody, for example, you know, a bit of information that I found really, really helpful as a parent was to learn that when a 2-year-old has a delay in talking, they're more likely to be aggressive. They're more likely to hit and bite because they're frustrated that their little peers at preschool can talk and can communicate what they need. And when you have a kiddo who's a little bit behind, they're more likely to act out. How helpful is that? I think there are a lot of times that people end up in mental health clinic with a problem that's of that nature, and what they need is education, and what they need is developmental guidance that, hey, this is how this works. And if you're prepared, then you can do a better job. And so I think the other thing that families need is a little bit of, this term's been going around now, mental health triage or basic mental health support. And there have been some articles written about the fact that probably everybody needs to know how to comfort someone who's in a crisis. And most people are not very good at that. I think the best people are folks who have been depressed, have been anxious, or have been in a crisis themselves. And so one of the things you often see if you see mental health patients is that people will come in and they'll say, you know, I had a suicide crisis and I had thoughts of suicide, and I told my dad, and he said, that's ridiculous. You don't feel that way. Or he got angry and he lashed out at me and he said, how could you say a thing like that? That's cruel. That's a terrible thing to do to your mother and I, right? And so training people in that basic support. What do you say to somebody who says they're having a suicide crisis? You say, I'm here. You say, I love you. You say, if you need to get to a safe place, I'll take you somewhere, right? And people don't know these things because we have so much stigma around mental health that we don't even talk about supporting basic wellness or what to do in these moments. And so likewise, I think I had a situation recently where I had a woman come into my office with her 15-year-old daughter, 14, 15, and she said, we are in crisis all the time. I don't know if I should send her away. I don't know if she shouldn't be in my home. She is just freaking out. She's melting down all the time. And I said, wow. And she said, I made a recording and I'd like to play it for you. I said, I think that's a good idea. So she plays me this recording and she said, as she's playing it, I kept telling her, I don't know if I need to call the police or what I need to do about you, but I have to do something. Well, I listened to the recording and it was the teenager just crying. It was all she was doing was just crying, sobbing the whole time. And it was very confusing to me why this mom thought she needed to call the police. The girl didn't say she was suicidal. She didn't throw anything. She didn't hit her mom. And so I said to the mother, which is, it's just really interesting on this issue of educating families, I said, did she threaten you? No. Did she threaten to hurt herself? No. Has she ever done that? No. Right? But she was losing control, and I had no idea what it meant. And so I think that's a great example of the kind of thing that doesn't really jibe, but this mom doesn't know. She has one child. This child has been struggling, and she thought that that was a moment to call the police, and nobody's ever told her otherwise. And so what an important reason to have a discussion like this about what they need to do on those front lines, The other thing that I think is the last reason it's really important to think about this topic is empowering families. I think a lot of families will do better if we give them some information and we give them some confidence about what they're doing at home. And so spending some time with them, giving them kudos for what they're doing well and mapping out what they need to do when things are not going well. Okay, and so some of the basics to teach people who are out on the front lines, the basic development, like I said, things like pruning, things like, educating people. I think there's a whole lot of knowledge about adolescence. There's not a lot of knowledge about other stages. And so what are the developmental tasks that a preschooler might be trying to achieve emotionally as opposed to a school-age child, as opposed to a tween? And so if you have a 9, 10-year-old, you start to see some shifts. I have a 10-year-old daughter. Anybody in here have a daughter who's over 10? Anybody with a daughter over 10? Yeah. So what I've seen over the last couple of years with my daughter is a whole lot of focus on the social group, a whole lot of worry about what the friends are doing, worry about people arguing amongst themselves and what she's going to do to direct that traffic. And these are new things. We didn't have that before. I'm fairly prepared because I'm educated on what normal is. But there's been this major shift and this kind of melting down. And so my daughter had a friend over, and her friend has been struggling because parents got divorced. It's been a tough time for them. And so it was late. We'd stayed up late. It was about 10:30 at night. And my daughter and her friend were in her bedroom just talking. And then suddenly they both just ran out of the room sobbing, wailing. Wailing is the word. And my husband and I were both there, and my daughter has a guinea pig in her room, and we thought, like, the guinea pig must be dead or something, like something bad has happened. And then here are these two wailing girls, and we're, oh no, what's going on? And they said, can we call Lindsay's mom right now and settle this argument that we've been having at school? And it was a social problem between the girls and their friend. And my husband said, why is this happening? Just like that. And I thought that was really an interesting statement, because parents need to know, like, why is this happening? Well, it's happening because they're 10-year-old girls and their bodies are changing and their brains are changing. and they're trying to understand their peer group and getting ready for adolescence. And so people need to hear that. They need to know what normal is. They need to know what kind of bumps might be in the road, for example, right? That's an example of what you might see. Of course, and again, we've done a good job with adolescents. We haven't done a good job elsewhere. We know that it's normal for adolescents to be risk takers. We know that adolescents may act out, they may push boundaries, and it's in preparation to leave the family. But we need to do that in a broader range for other stages as well. We need to talk about warning signs. So again, a really interesting thing. And so there's a combination of warning signs, ignored. So, and warnings, and people believing they see warning signs where there are none. And so both this week, I had a mom call me and say, I don't know if I need to bring my son in. I'm very worried about him. He had a project that's late for school, and now he's got to turn it in late. He's overwhelmed, and he's freaking out. He's in terrible shape. He won't communicate with me. He's melting down, and I'm afraid I'm going to find him hanging in his room, right? 15-year-old kid. And called me the next day and said he got to work on it, and he was fine. And so it was interesting because she raised the flag, but nothing needed to happen there. Same day, mom calls and says, yeah, I don't know if we're going to make it to our appointment. I'm not really sure if it's important to come. I mean, she's been doing okay. Well, she's anorexic and she's been restricting and her weight is dropping, but I'm not really sure what coming to the appointment is going to do. And so again, a reason to think about educating this person about the difference, because that is a red flag. A child being upset and not wanting to do a project or being overwhelmed by the project is far less a red flag than a restricting, eating disordered, underweight girl, right? And then crisis planning. I think we need to plan out with each family and with our communities, what do you do in a crisis? Where are the places you go? Right, and so we can talk more about that. And so in development, I think it's important to go through the different stages, again, with our community, with our families. The baby stage. Babies are fully dependent. Some families get frustrated, exhausted, have a lot of trouble with that. And then they grow into toddlers and young children who are mostly dependent. Some families have trouble with that. Some families struggle with the fact, either the excessive dependence going on, and other families struggle with the breaking away and the no longer being dependent. And so it's helpful for people to understand that that's normal. And then tweens and teens are mostly independent, but they're strikingly sometimes not. And so it's always interesting that people will say, I have this child of whatever age, 8, 9, 10, and they're very independent, and then they want to come over and they want to crawl up in my lap. And they're very needy, and I don't know what that means, and educating people to understand how normal that is. And then, of course, adults who are intended to be fully independent, but oftentimes are not. Parents begin preparing their kids all the time. So I think one of the things in educating families, in addition to what's normal and what to do if something's wrong, is to educate them on how well they're doing already and what they already know how to do. Because parents are already supporting emotional health from the beginning, right? It's a lot of what they do, and they may not understand that's what they're doing. And so talking to them about, what they've done to prepare their children to get them ready, and explaining what that is, and then it goes on from the earliest moments. And I'll give you some examples. And so, they may feel that they know little about it, but I think if we go out and we're doing outreach or we're educating communities about what parents and families can do to improve mental health, some things that we can talk about are the fact that you've been doing this all along, and we can educate them, for example, that parents, when they hug their kids and they say they love them, they're supporting long-term psychological health. There's a whole lot of evidence that having not a home where children are neglected or abused, right, is the biggest predictor for a long-term mental health problem for the rest of their life. And we all know that research. And so if you're hosting a seminar or you're talking to a family and you want to say to them, you know, you're doing a good job already, and let me give you some evidence. Part of the evidence is that they've come and they're seeking information, and part of it is that they love their kid enough to have already begun the process of trying to be a better parent and trying to learn something, and so they're already loving parents. I think you can very safely say to a group of people seeking education with regard to how to be better mental health triagers and better mental health supports to kids, that they're already doing a good job because they're loving in some way and they're doing the best they can. And so I think they need to hear us tell them they're doing a good job in that way. They soothe and support, you know. Children might be anxious, they might be sad. I listed some things here that came actually from an article about anxiety, but this is also true for sadness, that kids come and they say, you know, I'm afraid something bad is gonna happen, or they say, you know, I'm afraid I'm not gonna achieve what I need to achieve, or I'm not keeping up with my peers, or I'm falling behind, or whatever kinds of things, and parents say, you're doing fine, you're doing a good job. And so they're already, again, part of our team at home doing those things, right? They teach self-care. So I think this is one of the jobs that parents actually don't always do very well and need more education and information about how to do, because a lot of kids don't know how to soothe themselves. And you're seeing a lot of crisis with this on college campuses. You probably read articles about, you know, complaints about safe spaces, that there are trigger warnings, that on college campuses there are students unprepared to deal with adversity who come in and have trouble when their professor presents information about war or, you know, genocide or whatever, and shows pictures, and they're not able to handle that. And so one of the things that families do is they help support resilience by teaching kids how to calm down and how to take care of themselves, exercise, nutrition, all of those sorts of things. Some families are doing this very well and should be praised, and some families need a lot more education in that arena.